Thank you for joining VCCA's next installation in the Health in Our Changing Climate webinar series. Partnered with NVRC, we are incredibly excited to have our presenters today. Before we begin, I do just want to make sure you all know that all participants are in listen-only mode and this session is being recorded. Questions will be answered at the end of the webinar, but please feel free to submit your questions through the Q&A box on the Zoom menu at the bottom. Furthermore, instructions on obtaining CME credit will be provided after the scheduled presentations. Thank you. And with that being said, I would like to pass it on to Dale Medardis to take it away.
Thank you so much, Jayla. Good afternoon. I'm Dale Medardis. I'm a senior regional planner for the Northern Virginia Regional Commission, the NVRC. We are a regional council of governments representing the 13 counties, cities, and towns, and 2.5 million people in Northern Virginia. And for many years, the work of our agency has prioritized the development of climate resiliency initiatives for our local governmental members. And this has included looking at ways in which we can mitigate climate stressors like urban heat islands, intense storm events, and flooding, but particularly through applications involving green infrastructure. And the COVID-19 pandemic showed us something also very unique about green infrastructure and how all of this comes together. And that's the way in which urban forests and other applications of green infrastructure help address some really serious mental health issues. Think back to the times when we were confined in our homes and we all wanted to get out. And so we sought parks and the healing powers of the environment. So then, why Germany in the context of this webinar? Well, part of NVRC's work for many, many years has been to look for innovations that work really, really well and are ahead of our own in many respects in other countries, in cities like Leipzig, and then find ways to apply them through partnerships like this webinar with VCCA. And so, we have the very special privilege of hearing two experts in this topic, in particular that of Dr. Marselle, who has worked in Leipzig with an interdisciplinary team. And our hope, our expectation is as a result of this webinar, we not only have the opportunity to share with you the work that's been going on in Leipzig and how it potentially applies to regions like Northern Virginia and other parts of the United States, but that we stay in touch and then we find ways in which we can apply those lessons. So again, thank you so much, Jayla, Sam, also Drs. Hudson and Marcel for joining us. This is a really, really special pleasure. Thank you.
Well, thank you, Dale. And I also want to welcome everybody to our webinar. VCCA is delighted to partner with the Northern Virginia Regional Commission to provide this educational event. So my name is Dr. Samantha Adut. I am a pediatrician in Alexandria, and I am chair of Virginia Clinicians for Climate Action, or VCCA. VCCA was founded in 2017, and we are a network of over 450 health professionals and trainees advocating for climate solutions that protect the health and the welfare of our patients in Virginia. VCCA launched this monthly webinar series in June of last year, and since then we've heard from regional experts on the intersections of climate change and heat illness, waterborne disease, seasonal allergies, medical education, and more, and you can see all these excellent presentations on our website. But we have never discussed mental health or the healing potential of nature. So why is this important? Well, climate change is posing a major risk to our mental health. This is particularly relevant to me as a pediatrician. Just 2 days ago, the American Academy of Pediatrics declared a national emergency in child and adolescent mental health. Climate change is presenting a tremendous mental health burden on our young people. Young people today are scared, pessimistic, and feel betrayed about climate change. A forthcoming study in The Lancet found that almost 80% of American children feel that people have failed to care for the planet, and 68% are frightened of the future, and 63% feel that the government is failing young people. So clinicians like myself need to learn how to help our patients as they struggle with the mental health effects of living in a changing world and need evidence-based adaptation strategies that protect our physical and mental health. So we are therefore extremely fortunate to be hearing from Drs. Hudson and Marcel today. Dr. Kelsey Hudson is a licensed psychologist and research scientist in the Child Program at the Center for Anxiety and Related Disorders, or CARD, at Boston University. At CARD, Dr. Hudson provides an empirically supported assessments and treatments to youth with anxiety, depression, and social emotional difficulties, and conducts research on the psychological effects of climate change on youth. In addition to anxiety and mood disorders, Dr. Hudson also has a strong background in trauma-informed assessments and treatments with American and New American youth and adults. In her private practice, she specializes in supporting adults with climate distress. Dr. Hudson received her PhD in clinical psychology from the University of Vermont and a certificate in climate change and health from the Yale School of Public Health in 2021. Dr. Marcel is a lecturer in environmental psychology at the University of Surrey. Her research focuses on the health benefits of nature and biodiversity, as well as the psychology of sustainability. She earned her Bachelor of Arts in Psychology at Oregon State University before moving to the United Kingdom to complete her master's degree in environmental psychology at the University of Surrey, followed by a PhD in environmental psychology from De Montfort University. Her PhD evaluated the psychological well-being benefits of group walks in nature. Please welcome me and please join me in welcoming Dr. Hudson, followed by Dr. Marcel.
Thank you so much. Let me just share my screen quickly. I'm thrilled to be here. I really appreciate the introductions and the opportunity to be here. I think this is such a wonderful event, and I really appreciate the invite. So my name is Kelsey Hudson, and I'm a clinical psychologist. I mostly work with children and adolescents, but I also just started this private practice where I mostly see adults who are experiencing climate distress. I do not have any conflicts of interest or disclosures to make about the content of this presentation. So what I'm going to try to do today in a brief and hopefully not overwhelming way is to provide a comprehensive but short overview of the psychological impacts of climate change. And this will all mostly focus on adults, but most of it applies to kids and teens as well. I'll talk a little bit about the role of health professionals in supporting people with climate distress and offer some strategies for supporting your patients, which also applies to everyone else in our lives, and offer some resources for you as health providers. So when we think about the psychological impacts of climate change, there's a lot of different ways to think about the mental health aspect. These are some breakdowns. There are no right or wrong ways to think about it, but just to clarify a little bit, we think about direct effects, which could be, for example, PTSD or traumatic stress after an extreme weather event or a disaster. We can think about indirect effects. So that might be something like distress about land loss due to climate change, or distress if somebody is in an agricultural community where crops have been impacted. As you all know, we can think about the physical health comorbidities. So for example, individuals with asthma are at baseline at increased risk of mental health challenges. Pair that with increased pollution, air quality issues, we can expect to see a lot more intersections between physical health and mental health. And then there's kind of this more nebulous, less defined psychological distress that can just come from having an awareness of the crisis or learning more about the crisis. This is in no way a comprehensive list, but these are some ways that we can see the psychological impacts of climate change occur. So it's pretty well documented that following extreme weather events, there's significant increases in educational, occupational, family-based, cognitive, and mental health concerns. So we'll see things like stress, anxiety, depression, and traumatic stress. Climate change is also increasing risk factors for ACEs, which we know can affect all of development, leading to difficulties in adulthood and older adulthood. We also know that there are greater mental health impacts on communities affected by systemic issues like racism and systemic inequalities and economic inequalities. We know that hotter temperatures are associated with things like decreased cognitive capacity, increased aggression and violence, and greater use of emergency mental health services. We also might see things like grief around species or land loss. This comes up a ton in my private practice, a lot of trauma and grief about the loss that we are collectively experiencing. For us as health providers, we can also think about how we might start to become vicariously traumatized or maybe are already experiencing that. So I think COVID is an excellent parallel to this. Climate change is something that each individual is going through, and although we will all be differentially impacted, as things unfold, we may start to experience more compassion fatigue and burnout. As we'll hear more about later, we might also start to see more mental health effects, and we already have seen this from changed environments or decreased access to nature and greenery. And like I said before, there can also be just a general sense of distress from having an awareness of climate change. It's also really important to think about all this through the lens of climate change as a climate justice issue, in that climate change is thought of as a threat multiplier or inequality multiplier. And many people have argued that climate change is a social justice issue and a human rights issue. And in the child world, people are starting to think about climate change as a child rights issue as well. Moving into what we might see in terms of more nuanced feelings when people have climate distress. This figure up here is from the Six Americas work through Yale. Just a little graphic to show that a great deal of people are concerned and alarmed about climate change. So all of these feelings may exist on a spectrum, but we can see things like hopelessness and helplessness, feelings of powerlessness, avoidance and resentment, loneliness, really difficult emotions like anger and fear and anxiety, sadness and grief, and despair, guilt, and shame comes up a lot with trying to navigate our individual lifestyles or collective high carbon lifestyles in the midst of this global crisis. Moving on a little bit to thinking about our role, and this relates to all health professionals in every domain. We will also have to be able to observe and respond to our own emotional and physiological and behavioral responses about climate change before we are able to connect with and help others going through this, or in tandem. So for many of us, especially in the training fields, self-care and caring for ourselves can be thought of sometimes as kind of a checkbox, but really, I would argue that in this domain, it's our ethical duty to try to make sure we are meeting our own needs and able to understand our own emotional awareness around climate change so that we can model that to our patients and have the capacity to use our training to engage and take action and advocate. I'm not sure if this will resonate for others, but I have navigated a good deal of imposter syndrome in the climate change world because my training is in clinical psychology, and there have been many times when I felt like I wasn't equipped to navigate some of the scientific components of climate change. But I want to pause and say to all of you that it is well within your power to use your position and your training as health professionals to make a huge impact. It can be easy for us to pass over the power that we have and the trust that people and our patients have in us. And we can do things like talk with peers, talk with our patients, and use the training and the skill sets that we already have to fuel our arguments for why climate action is immediately necessary and urgent. And I would say that VCCA is a really excellent example of this, in that you all are using your training and your positions to advocate, take action, educate, etc. Sort of an admittedly random slide, but I wanted to give everyone an opportunity to see this amazing paper, which is an interdisciplinary paper on coping with climate change from a lot of different fields. And it relates to all of us as health professionals, but it's also really easy to read and can be used for educational purposes and personal purposes. So these slides will be available, but also I just wanted to put in a plug for this because coping with climate change can be really complex, and this is an excellent paper that kind of lays out many different ways to promote adaptive coping. So in our time left, I am going to go over some brief strategies for supporting patients, and this comes from my background is in cognitive behavioral therapy and acceptance and commitment therapy, and there may be a lot of different and beautiful ways of supporting patients. So this is some empirically supported work from those fields. The most important thing that we can do, especially as we hold positions of great privilege and power as health providers and community healers, is to normalize and validate our patients' emotional experiences. So you are welcome to say whatever you want, but some examples of this might include something like, it makes total sense to me that you'd be feeling this way. It's really important that we take climate change and mental health as a non-pathologizing conversation, and that we emphasize that distress about climate change is actually extremely normal and very appropriate in terms of our instinctual, adaptive emotional responses to threat and loss and trauma. So I can't emphasize enough how powerful it is to have a provider or a trusted person normalize and validate those emotions. If you are sitting with somebody who you have time to go further with, or you feel like that would be helpful medically or clinically, you can ask some questions to assess their coping strategies or style and how they're managing distress. So you could say something like, what are some things you're doing to cope with those feelings? If the word cope might be a turnoff for some people, you could say deal with or manage or help yourself. What we want to do here is assess how people are coping and whether those coping skills are adaptive or maladaptive. So things like avoiding or becoming paralyzed with fear, while understandable, are not necessarily adaptive coping strategies. Other things like substance use or looking way too much at climate-related news, also, while understandable to get rid of the bad feelings, they are not going to be helpful in the long term. Alternatively, things like increasing social connection, engagement with the issue, mindfulness or meditation, those might be more adaptive coping strategies. This next part is admittedly wordy, but I wanted everyone to have the information. So after you've assessed coping, it could be time to gently encourage more healthy coping if somebody has maladaptive coping strategies, or just provide some resources after you've normalized and validated. So what we know from the research is that coping strategies that involve making meaning or having a purpose and living in line with our values or what matters to us, what's important to us, are in general, not always, but are in general really helpful guidelines. With that being said, it's not like that's a prescription, and we need to be attuned to how different people will need different things. And so we can do that by looking at the nature of the climate stressor, as well as individual differences in how people are coping. An exaggerated example would be something like what you would want to say to somebody who is in the acute stress period after a natural disaster would be totally different than somebody who's coming to you with a lot of distress about the decision to have a child because of climate change. In general, we can think about an opposite action approach. So for somebody who is really withdrawn or avoidant and scared, we may want to gently encourage more engagement with the issue. Versus for people who might be really overengaged or burnt out, many individuals in my private practice are climate activists, and they would fall into this category. They need coping skills that are really based on slowing down and caring for themselves. So that can involve some clinical judgment as well. One trap we can fall into is to continue the propaganda that has been perpetuated by the fossil fuel industry and only focus on individual actions. While that is, of course, incredibly helpful and can increase our agency as individuals, it's also really important to think in a systems way and think about your patients as embedded within their collective system or their community, and how can they get connected to that community resilience as well. More practically, we can just make use of the intervention strategies that we have used in similar contexts to help build resilience and coping. So for example, elements of eco-psychology and connection with nature, treatments for things like chronic stress or grief, anxiety, trauma, and depression. Those are elements of how some people are showing up to the crisis, and we can use our existing skill sets or referrals to help in those settings. And then we want to leave people with a sense of an ability to keep monitoring how they're doing, to treat themselves with compassion, which will come from the normalizing and validating that you've done, and to try to be flexible in how they're coping with climate change. I want to provide a few resources that you may already know about, but some of these you can give to patients or use yourselves. For patients, there is an excellent directory through the Climate Psychology Alliance that shows by state individuals who provide climate aware care. That can be a really great resource. There are also less formal resources like eco-focused mindfulness and groups called climate cafes where people can talk about their feelings. And if you're trying to gently encourage somebody to perhaps be more engaged, you can give them information about some local, national, or international organizations. And some of these organizations have more scaffolding than others, like they will give people a script for calling representatives or contacting the fossil fuel industry. In terms of professional resources, I'm sure VCCA has a million that are widely available, but these are some other ones. Talk Climate has a lot of really wonderful resources in it for a variety of settings. And there's a lot of medical and psychological organizations and resources through those organizations as well. I really appreciate everyone's listening, and I'm excited for the discussion. That's it for now, so I'll stop sharing and we can move on to our next presentation.
Okay, so that's me now. I'll start sharing my screen. Okay, I hope you can see the first slide. Thank you for, oh dear, hold on a minute. You can't see me. This is a problem. So I'm going to stop my sharing. I'm going to show myself. There we go. And then I'm going to start sharing again. There. It's 5:30 in the evening here in England, so that's going to be my excuse for my current behavior there. So and it's cold. It's cold in the northwest of England as well, and gas is really expensive, so I can't put my heating on. So thank you very much for inviting me to speak today. This presentation is going to be about trees in cities as a potential nature-based solution for mental health. This is a result of a study that was conducted in the city of Leipzig when I was doing my postdoc there with an interdisciplinary team from the Helmholtz Center of Environmental Research, IDIV, which is the German Center for Integrative Biodiversity Research, with data from the University of Leipzig's medical faculty. So a disclosure, I'm talking about street trees and their relationship to mental health in the city of Leipzig, and I have no conflicts of interest or disclosures to make regarding the content of this presentation. So for a bit of context, we currently live in a time of crisis. Growing urbanization is a threat to both biodiversity and mental health. And as global urbanization continues, it's projected that about 5.2 billion people will live in urban areas by 2030, which means that land use change is changing from green space to urban cities. So action is needed to reduce the future risks to both people and nature, which is why the UN has said that this decade is the decade of rewilding. So there's now a focus of how can we rewild or reintroduce nature into our cities for the benefit of both people and nature. So urban nature-based solutions, such as planting trees or growing the urban forest, might be a preventative solution to tackle both mental health challenges as well as biodiversity loss, in addition to fostering urban resilience against climate change. Some of you may be aware of the UN Sustainable Development Goals. And I just want to highlight that growing the urban forest, planting trees, rewilding cities could help address a nexus of these sustainable development goals by creating sustainable and healthy cities. So addressing the SDGs with regard to human health and well-being. So SDG number 3, creating a sustainable city. So SDG 11, and also conserving terrestrial ecosystems, which is SDG 15. So in order to address these sustainable development goals, policymakers, urban planners, designers, and others need information about which specific types and qualities of urban green space are likely to influence mental health. In the UK here, there's a growing recognition that perhaps GPs, medical doctors, can prescribe time in nature for mental health. But those GPs need to know information about what types or qualities of the natural environment are going to be effective, so they're not prescribing the wrong types of environments and giving an ineffective prescription, if you will. So just a little bit about street trees. Urban nature-based solutions, such as trees on streets, could be a preventative solution to tackling mental health challenges and biodiversity loss. And this is because trees are a really important component of the urban forest. They're a really common form of urban biodiversity that contributes to the conservation of trees and other species. There are public amenities that are located throughout the urban matrix, and they can be easily retrofitted into urban areas where there's limited opportunity for putting in new natural spaces or green spaces. But in addition, as Del said in the introduction, urban green space such as street trees can provide various ecosystem services for human health and well-being, such as air quality or climate change mitigation by reducing the urban heat island effect. But to date, there's very little that's known about whether or not these street trees also could have a benefit on mental health. So there's a lot of research and systematic reviews have shown that urban green space has a positive benefit on people's mental health and well-being. And this research is done both in clinical health, but also public health. And at the public health level, much of this work focuses on people's exposure to the quantity or amount of urban green space. And it's typically considered generic. It's measured using satellite imagery of just a normalized difference vegetation index. So just all the green stuff in a city or the density of tree canopy. And that's then associated to people's either self-report of their health or well-being, or maybe objective indices as well. But far less work has examined the influence of specific types or the quality, like ecological quality of that green space on mental health. So there are very few studies that look at, say, street trees and the ecological quality of street trees on mental health. And this data could be really helpful to health professionals, urban foresters, city planners, urban designers, and individuals responsible for policy and planning decisions. So this study is building on two other studies that were also done in the UK, looking at the relationship between green space and antidepressant prescriptions. And we wanted to know, what is the role of the quality, so ecological quality, as well as the quantity or amount of street trees in relationship to antidepressant prescriptions. We wanted to know at what spatial distance would these relationships have an effect. So there's no consensus for how close nature needs to be towards the home to have an effect. And so we examined 4 different spatial distances that I'll talk about. And also we wanted to examine the dose. Beyond that, we wanted to see for whom street trees might have an effect. And in Germany, women, the unemployed, and individuals of low socioeconomic status are at greater risk for depression. So we specifically looked at those target groups to see if there would be any buffering or benefit to living in an environment with more street trees. So we tested the association between street trees, both their density or amount of them, and the species richness of those trees on antidepressant prescriptions using secondary health data from the University of Leipzig's medical faculty. They have a cohort study called the Life Adult Study, and it is an assessment of 10,000 people who live in the city of Leipzig. And we had data on the GIS location, so where people lived, for 9,571 adults. And then in that study, those participants were asked to bring all the medications that they had taken in the last 7 days. Those medications, the barcodes were then scanned and then identified using the anatomical therapeutic chemical classification, so the ATC system. And I then identified antidepressants based on that ATC classification of N06A. And then the data on the location and species affiliation of all public street trees throughout the city was obtained from the city of Leipzig, who have an open access map where they have the location and also species affiliation of all trees on the street. Sorry, I'll just get rid of this maybe so you can see that a bit more. There you go. And so from this, we could find out where are all the trees on the streets located and what type of tree is it. And then with GIS, we created Euclidean buffers. So 4 different distances around the participant's home. So 100 meters around the home, which is about 300 feet, and then 300 meters, 500 meters or half a kilometer, and then 1,000 meters or 1 kilometer around the home. And then within each buffer, we then captured the quantity of street trees, as well as the quality, so the number of different tree species within that buffer around the home. As street trees are dependent on the presence of public streets, we converted the abundance or the number of trees on the street into a new variable, which was street tree density, by dividing the length of the street within each buffer by the number of trees. So here you can see the map of the city of Leipzig, and the colored dots are highlighting the density of street trees, and then the just the black dots that don't have any color in them are the location of participants. In our sample, almost 600 participants, or about 6% of the sample, had been prescribed antidepressants. And this is representative of all of Germany, which has a prevalence of antidepressant prescriptions of 5.6. And from this, participants, we can see that participants and those that were prescribed antidepressants were distributed throughout the city, and also that street trees were planted more or less throughout the city, although they are concentrated more densely in some areas than others. I can give you information on the total number of street trees. It was 66,000 street trees, 51 genera, and 131 different species. I'll just quickly go over this. In ecology, there's this idea that there's a luxury effect of biodiversity, which assumes that affluent areas or people with higher socioeconomic status will have or live near areas of more biodiversity. And so we tested that in our sample here. We found that the minimum and maximum number of trees and the species richness of those trees, we did not find a luxury effect. In fact, we found that there are more trees and greater species richness of street trees around the homes of individuals with low SES in our sample. So accounting for covariates, people living in homes with a greater density of street trees within 100 meters around the home were less likely to be prescribed antidepressants, although this relationship was marginally significant with a p-value of 0.057. And you can see on this graph here at the left that there seems to be a trend in which the density or amount of street trees reduces the risk of being prescribed antidepressants the closer it becomes towards the home. You can then see on the right that we found no significant association between the species richness or the type of tree that is around people's home on antidepressant prescriptions at any distance. So it seems that it's really the tree abundance immediately around the home that seems to matter. This graph just shows the generalized additive models with a binomial error distribution that we ran, and just showing that the other covariates that were included in the model, and that there was a greater risk of being prescribed antidepressants if you are a pessimist, overweight, obese, a smoker, or a woman. And reduced risk of antidepressants was associated with being optimistic, employed, young, and old, and marginally by having a lot more street trees within 100 meters around where you lived. So for our next research question on whether the street trees would buffer the negative effect of health inequalities on depression, we only focused on the street tree density 100 meters around the home, so 300 feet around people's homes. And we stratified this analysis by low and medium high SES. And we found that there was a significant negative effect of street tree density on antidepressants for those in the low SES group only. In that greater density of street trees at 100 meters around the home reduced the probability of someone being with low SES being prescribed antidepressants, which is really big because they're at greatest risk of being prescribed antidepressants in Germany. We didn't see this effect at all, where greater density of street trees immediately around the home had any effect on antidepressant prescription rates for those of medium and high SES groups. And so just highlighting that the street trees around the home seemed especially important for individuals with low socioeconomic status. Flipping this or showing the results in a different way, we're now looking at how the risk of being prescribed antidepressants changes as the density of trees are immediately around one's home increases. So the net result here is that under low street tree density, individuals with low SES have about have a higher risk of, or a higher probability of being prescribed antidepressants, but that risk reduces as the density of trees on the street increases. And we get to the point where under the highest street tree density, the difference in the probability of being prescribed an antidepressant is almost very similar between those with the highest and the lowest SES. This finding is in line with other studies that are conducted in the UK that find that living in an environment with more green space can reduce these socio inequalities in health between those with the lowest and highest SES or socioeconomic status. So just to sum up, quantity appears to be more important than quality, that the spatial proximity to the home matters, and that these unintentional everyday contact with nearby nature seems to be important. And this is contrary to most of the literature and policy, which is focused on getting people to have intentional visits to green space for recreation. So this study and others conducted during the COVID-19 lockdowns suggest that perhaps we should change our focus and look more at these unintentional everyday contact with nearby nature, So we need to think more about how we can bring nature to people instead of getting people to nature. Our findings also suggest that we can add we can grow the urban forest by adding more street trees, specifically in residential areas, to address the nexus of sustainability and public health goals. So this means that street trees could potentially be a green infrastructure intervention to address health inequalities. But they need to be planted in residential areas rather than in the business district, for example, or lining an existing park. And then finally, as I said, by planting street trees in residential areas, it can aid progress towards multiple sustainable development goals. And that in conclusion, nature-based solutions could be a potential public health intervention. And this has implications for green infrastructure design and planning decisions and public health policy. And that, as I said before, this suggests, where we plant or where we grow the urban forest is really important. So I would suggest, in residential areas, and to prevent green gentrification, have street trees planted equally throughout the city. So thank you for your time. And I want to thank my colleagues in Germany and my co-authors. Thank you.
Excellent. Thank you so much, Dr. Marcel, for your presentation. And thank you again to Dr. Hudson. I will go ahead before we take questions for our lovely presenters and just inform everybody on some potential advocacy opportunities that we have lined up. Let me go ahead and get that up for you all. So we actually have an opportunity to write to your elected officials in support of climate action now. And I will go ahead and put this link in the chat for all of you. It is on our website. If you would like to show your support and sign on for elected officials and members of Congress to take action and support policies that support climate action. We also would like to remind everyone of the election on November 2nd. If you are a Virginia resident, the Virginia election is important, and we just think everyone should take part in that. In regards to CME credits and recorded webinars, the recorded webinar will be available on our website and on our YouTube tomorrow, so the day after the presentation, and you can refer to it. You can use the slides. I did see a question regarding the receival of those slides. If any of you would like the slides themselves, please feel free to reach out to VCCA, and we can get that provided for you. You can also use these QR codes that are here to obtain your CME credit and follow those instructions. However, if you do not use the QR code, no worries. We will get an email sent out to you after the presentation today with instructions on how to claim your CME credit. And I also urge you guys to look at our other webinars that we've done on our website. It's under the videos and webinars section on our website, or you can check out VCCA's YouTube channel as well. And with that being said, I would like to pass it on to Dr. Ardut to handle the questions. Thank you.
Excellent. Well, thank you so much, Jayla. So I'd love to pose these questions to our presenters. The first question we have is, I've heard some clinician reluctance to use the National Park Service Park Prescriptions Program because quantitative data is lacking. Is there a source for this type of data that could be shared and provided to clinicians? Dr. Hudson or Marcel, do you have any particular thoughts on that? I will say that as a pediatrician, I have personally gone to the Child and Nature Network site. They actually are a really good source of published articles that have looked at the benefits of nature for children. So, and the mental health benefits particularly. So I often go to that site. And there was a recent publication, which I have to look for, that specifically evaluated the benefits of nature for children, but they're put into one site on the Child and Nature Network. Any other sites that you would recommend, either of the speakers?
Dr. Hudson, you're based in the United States, so you might be better placed than me to answer that if you have any ideas.
Yeah, I actually, I didn't know about this program. So I will have to look into it. But yeah, the research is extremely clear and robust about the mental health impacts of spending more time in nature, including city nature. So I would feel confident going off of the existing research, but I don't know anything about this specific program, unfortunately.
I'm part of an international interdisciplinary project looking at green social prescribing in the US, the UK, and Australia. And so we'll be looking at the providers of these programs, but I think this is an excellent question about the need for robust evaluation of providers of nature-based interventions to make sure that they are evaluated and it is robust. But as Dr. Hudson said, there's about 40 years of research showing on the mental health benefits of nature with numerous systematic reviews and meta-analyses.
Thank you both. Our next question is, this is for Dr. Marcel. Did this study take into account how the individuals experience nature as they move through their surrounding environment? For example, walking, biking, driving, or transit. I imagine there's a marked difference between walking amongst trees versus driving through them.
This is an excellent question. So this is a limitation of this large scale epidemiological studies where we associate the amount of green space around someone's home to a health outcome. We don't know, if they use that green space. We don't know how they experience that green space. You're absolutely right. We can infer because of the distance that it's 100 meters around the home, that the contact that the individual is having with those street trees will largely be on foot. This is, just based on the physical distance, as well as the design of the residential environment in Leipzig is very different than the design of residential streets in the United States. It's very high density housing with apartment blocks that are 4 or 5 stories high. And so in that respect, it's good for the city because that street tree, that one tree is hitting maybe 20, 30 family households. And because of the high density, 100 meters around the home, you're walking towards your car because it's parked on the street, or you're walking towards, going to the local supermarket to get a pint of milk because the supermarket's just 3 blocks away. So from both the physical distance and the urban design elements of Leipzig, the experience is largely going to be biking or walking. That's a hypothesis, but we don't have any data on that.
Thank you. We have a comment here from Suzanne Foster that Casey Trees is very active in the area, that they've having documented all the trees in DC, and that they're an excellent resource. So they're working with Fairfax County to plant trees in urban heat islands, and also remarking on the nonprofit called Plant Nova Natives, which has got a vigorous campaign to plant trees in low socioeconomic communities, and that they are a great resource. I'll mention also another Virginia resource, which I've recently learned about, been very impressed by, called Southside Relief, RELEAF, which is in the Richmond area, which is all focused on bringing more trees to that area around Richmond, Virginia, and another group called Groundworks VA, which is also in the Richmond area. So I think these these local groups doing this work. I think the work that you've done is clearly highlighting the value of local tree plantings, and particularly for low SES communities. So I appreciate that. And there's a couple more, another resource that one of our, some of the panelists have mentioned. One is a book that Colin Ackerman is highlighting, The Nature Fix, Why Nature Makes Us Happier, Healthier, and More Creative. It's in the chat box, and a couple other resources from ParkRx are here from Tom Fish. These look great, from the National Park Service. Let's see, what time, how are we doing on time? So we have a couple more minutes. And I could ask a question. Oh, do you have another comment, Dr. Marcel?
Yeah, so this project of looking at street trees and antidepressant prescriptions came about, as I said, from previous literature, of course, but it wasn't initiated by the city of Leipzig. They didn't come to the Helmholtz Center for Environmental Research asking us to evaluate the mental health impacts of their existing planting structure. It was something that we did as researchers. And so I'm just suggesting, that your ideas here of the Casey trees and the nonprofit Plant Nova natives, you could use that existing data that you have on the trees and what's going on, and then evaluate that in some fashion. I just want to encourage people that that you already have some infrastructure of the natural environment. You already have, you know what's going on, and just think about ways that you can evaluate the impact of that.
It seems like a great opportunity for collaboration, perhaps with help with researchers, research center, of which we have obviously many in this area. Dale, did you have a question?
I just want to pick up exactly on that point, Samantha, and ask Melissa. You have this unique privilege of being an American, having looked at this really unique city and the projects and the research. It's very special. Who are your counterparts in the United States, and are there any in Virginia specifically that are conducting maybe equivalent research with whom we can tie, network, link? What have they published? Give us some suggestions if there are any.
I'll have to. So is it okay to mention North Carolina to people in Virginia?
Yeah, sure.
Okay, I wasn't sure. Yeah, so on this no on this park prescriptions project that I mentioned, where we're looking at green social prescriptions in the UK and the US and Australia, I'm working with Dr. Aaron Hipp, who's at North Carolina State University, on this. One of the interesting things is that park prescriptions for the reason for them in the United States is different than here in the UK. In the UK, we're using park prescriptions largely as preventative mental health solutions. But for the US, it seems like it's more of a physical health intervention, which is really interesting. And I'm just going to check. I think Jenny Rowe might be in Virginia. Yeah. So Jenny Rowe is at the University of Virginia's School of Architecture, and she's an environmental psychologist. And she just published an excellent book called Restorative Cities that to me is really great, because it has all the literature on the health benefits of nature, both green and blue space. But then each chapter has design solutions and suggestions for creating a green city, a blue city, a healthy city, an inclusive city, and a child-friendly city. So Jenny Rowe is definitely a good person who's local to you.
That's excellent. Thank you. And I have here Colin Ackerman from the Medical Society Consortium on Climate and Health, also put in some references for Dr. Lanza in Texas, also, and who is studying trees and shading impact, particularly regarding children's health and health inequity. Great. I have a question for Dr. Hudson. As a practicing clinician, it can be very hard to bring up the topic, and particularly in general care, outside of a specialized clinic, it can feel very daunting to even mention climate distress. And do you have any particular phrases or transitions that you find would be useful in broaching this topic in the setting of outpatient medicine?
Yeah, that's a great question. And especially important from a communications perspective, because we know that especially for people who are not in the alarmed or concerned sections, it can actually fuel denial to use terms like climate change and global warming. So it's a really important question if we are just going to talk colloquially, I can't say that word, in our community interactions or in our patient care interactions. So I think some good advice is to use mutual common shared experiences, like if it has been hot recently, if there has been a lot of wet or extra rain, to talk more about the details and the practicals, and to see if you can join the person, and then try to see if that particular experience, which may relate to climate change but isn't necessarily going to cause any sort of politicized reaction in a person, is making them feel, any sort of feelings like worried, distress, etc., that you could move forward with. I would also highly recommend Catherine Hayhoe's new book, which has a lot of really amazing information about talking about climate change and joining with people who may not see eye to eye on the issue.
Thank you. And maybe we could segue that into, and that's why it's important to consider planting trees near your house, or working or spending time at your local park. All right, well, any other questions that we have? I don't see any more here in the Q&A or in the chat. And I think we're at time anyway. So thank you both so much for this excellent presentation. I really appreciate it. I think everyone's gotten a lot out of it. And thank you, Dale, and for the Northern Virginia Regional Commission for this excellent partnership. It's been great working with you. And thank you all for attending, and hope that we'll interact again soon. Bye-bye.
Bye, thank you so much.
Thank you, everybody. Have a great rest of your day. Bye-bye.